So the RESSCW project is a project that is funded by the Health Foundation's Efficiency Research Program. It started in April 2019, and it's planned to come to an end in July this year. We would like to present today main findings from our work and discuss with you potential policy implications. We would like to acknowledge the support from Skills for Care and ONS, who provided data used to produce most part of the research that we present here today. Nonetheless, the usual disclaimer applies that the views expressed are entirely those of the authors. Regarding the team, so the project is a collaboration between a team of researchers from the University of Kent, the London School of Hygiene and Tropical Medicine, City University London, the University of College London, and with a strategic partnership of Skills for Care. The main aims of the project were to bring hard evidence on drivers of retention of social care staff, as well as timely assess what impact the COVID-19 pandemic had on social care workforce well-being and retention. And through this, to fill an important gap in the understanding and the discussion of what measures and policies are feasible to improve staff well-being and retention in the social care sector. We will present today findings from 6 different strands of work: a scoping review on the international literature on factors associated with retention of social care workforce, an empirical analysis on retention of care workers in adult social care compared to healthcare assistant in the NHS using the annual population survey, a study of job separation and sick leave of frontline staff using the adult social care workforce dataset, an analysis of care establishments, turnover, hiring, and vacancy rates, and their relationship with employment dynamics using the same adult social care workforce dataset, a study of retention and sick leave of personal assistants using the Skills for Care survey of individual employers and personal assistants, and primary data analysis of the effects of the pandemic on retention and well-being of social care staff. We will have a Q&A session at the end of the webinar, so I would like to ask all participants to put in their questions in the chat during the presentations, and we'll have that discussion at the end. And without further ado, I give over to Shireen, who will present on the first study.
Hello, everyone. Thank you so much for coming. I'm just trying to get hold of the, yes, here we go. So my name is Shireen Hussain, and I'm a professor of health and social care policy at the London School of Hygiene and Tropical Medicine. And I'm a co-PI with Florine on that project, but also leading on a number of work packages. So I'm going to briefly talk about our first work package, which is to map really and critically review the literature. And that was one of our first work packages, and the purpose of it primarily was to inform the thinking around the team and the kind of the issues that the international literature identify as key in relation to the retention and sustainability of long-term care staff. So we had a review. It's not a systematic review, but it has systematic elements to it. And we had 4 main questions. Thinking about the macro, meso, and micro factors that is associated with commitment, retention, and turnover in social care or long-term care, as it is known in the international literature. And then thinking how these factors shape the commitment and retention, and particularly if there are any evidence of causal or correlation dynamics between factors. And then also to know what is known about the degree of commitment and what is known about the destination of those who are quitting social care jobs. So again, I'm trying to get hold of the slides. I'm really sorry about this, but Grace, is it possible to go for the next slide? Yes. So in terms of methods, we developed a search protocol, and that is completed early in 2020. We looked at all publication and outputs published in English in the last 15 years. And the original search protocol retrieved over 16, nearly 17,000. Obviously, it's an iterative process with any review. So we have, developed and improved the search terms, and we've gone through a whole process of assessment. So we have a Prisma chart to show, but we didn't include in this presentation. And at the end, we assessed that there is 140 outputs to be included in our analysis. We analyzed all data using a narrative critical review, and a number of researchers worked on this assessment. We published a policy brief of the results in September 2020. And then in 2022, we decided to update the literature review, because basically what happened with the pandemic and COVID-19 and the amount of interest in the social care sector for all the wrong reasons, but there was a lot of publications, and we are currently preparing a submission for a journal, kind of a peer-reviewed special issue. The main findings really that when we think about the factor associated with recruitment and retention, there is a number of different factors at different levels, as we briefly mentioned in terms of the macro, meso, and micro levels. In terms of recruitment, there is importance in relation to the motivation of individuals, their personal characteristics, and the same actually factors and other factors as well affect the probability in them staying in the social care sector or moving to a new employer within the sector or moving to another role, and also affect their decision to quit. And the decision to quit, then obviously that will lead either to leave the social care or to exit the whole labor market. When we think about decision to quit, some of the factors that came strongly in there were three categories: personal characteristics, job characteristics, and working conditions. And within personal characteristics, a number of studies highlighted the health status of the individual, their age, and their education level affects the probability of quitting and the decision to quit. Particularly younger age groups and those with higher qualifications tended to, in a number of studies, come up as more likely to quit the social care sector. And in relation to job characteristics, there was a very strong theme around the emotional labor of care and how that creates and interact with the job-related stress. And there has been some development in this work further on, but these are really important to highlight. And how this sits the nature of work in the care sector across the boundaries of vocational work and actual labor, impact on who can quit or who can stay, but also impact on the well-being of individuals who remain in the sector. Then in terms of working conditions, rather than just thinking about wages, what the literature have highlighted that there are material and non-material aspects of the working conditions. So although wages are generally poor, they were not the primary driving force to quit. There were more other non-material aspects within work, like the support, the line management, the kind of culture of work, the environment, and the relationship actually with people who use the service. And in addition to these, there were also other global, national, and local factors. So, of course, things like the care chains, migration, welfare policies, and local kind of dynamics affected. So, for example, what are other employment available within a local labor market? What is the unemployment rate within a certain locality? All affect the kind of attachment and disattachment of workers from the social care sector. So in terms of, so we have put an initial conceptual framework, as I said, which informed a lot of our further analysis in different work packages and thinking about the cycle of recruitment, retention, separation, and churn. And what came up very strongly is the issue of well-being, and how that is affected, how is that shaped, and also how that affects the decision to quit or be returned. What are the policy implications for this? So although that this work package was meant to inform the working of the whole project, the literature actually highlighted a number of policy implications. So for example, it's ensuring better care jobs is more than improving wages. So as if we say improving wages is a necessity, but there are much more than that. And it's really the quality of the job and the status and the respects and feeling parity with other jobs, whether it's in related sector like health, but also in other sectors like retail. It also throw in the idea of recruitment pools. So who you're going to recruit and which groups you can attract and how you can shape the tasks and the dynamics within the care, the delivery of care to attract other pools. And why, for example, younger people might leave, why those with higher education might leave. It's likely because there is not much career progression. So how can you create different aspects of work to attract those and training and the value of within job support. And that is really important when we think about the care sector, where we have home care, when we have living care, when the mechanisms of support are varied, and also to think about the external factors. So I'm going to stop here because we have a lot to say, and I'm going to hand into my colleague. I think John is speaking, so I'm going to stop sharing here.
Thank you, Shireen. Grace, why don't you retain control of the slide deck?
Yeah, that's fine. Thank you.
Thank you. So my name is John Forth. I'm a senior lecturer at Bayes Business School. And the work I'm going to talk about briefly in the next 5-6 minutes is joint work with Alex Bryson. And the work that we're reporting here uses the annual population survey, as Florin noted earlier in the session. So just looking firstly at the motivations, Shireen has set some of this out already. Of course, we know that high rates of job separations in social care have negative implications for those who are receiving that care. And there's some debate about the role of wages. So in some parts of the literature, you would see that low wages often thought to be at the root of the problem for retention. But there is limited evidence and there is conflicting evidence on the role of wages here relative to other working conditions, as Shireen has just noted. And there are also concerns about people leaving the social care sector, perhaps to work in other sectors, maybe retail and so on. But again, the evidence on this is relatively limited. So the kind of things we're trying to address here, firstly, what kinds of personal job and employer attributes are associated with a higher probability of leaving the job, so separating from the job with a particular employer. To what extent are care workers actually being attracted into other competing occupations or sectors? And then if we look across low wage occupations in general, we see that some have much lower separation rates or exit rates than in social care. So how is care work actually different from those other types of low wage occupations? What we're using in this analysis is survey data from the annual population survey. So that's not the standard source that's used in this literature. Most of that uses the Skills for Care workforce dataset, and Florin and Stephen later will report on that. But we're using the annual population survey produced by the Office for National Statistics. That gives us data on around 6,000 care workers in adult social care. They're interviewed on 2 occasions, 12 months apart. We have 10 years of data, starting in 2011, moving through all the way to 2020-21. Okay, so over that 10-year period, we can look at the exit rates amongst care workers. We can see where they end up. And that's really the unique selling point of these data versus the skills for care data, is that we observe all of the destinations. So if people move to non-employment, to inactivity, move into higher education, we know the destination they've gone to. And also, because the annual population survey is not focused only on social care, we can compare the experience of care workers with those in other similar low-wage occupations. Okay, so that's the value of having a general data set. So what are some of the headlines? Well, firstly, the separation rates. In these data, around a quarter of care workers in adult social care leave their job on average each year. That's similar to what you would see in the skills for care data set. It rose slightly in the early part of the decade, and it's been relatively flat in this data set since about 2015. Where do those people go? Well, when they leave their job, around a third of them go to another job in adult social care. So in other words, they're moving around different jobs within the sector. Another third of them move outside the adult social care sector. So they're moving perhaps to some part of health or retail and so on. And then a third of them are going to non-employment. So perhaps they are retiring early, or they're maybe moving to go into higher education, or perhaps they're stopping work to look after a family. So if you think about those last two groups, those moving to other jobs outside of social care and those moving to forms of non-employment, that means that around 16%, or around 1 in 6 care workers, is leaving the social care sector every year. That's reasonably stable. So what we'd call sectoral wastage. So what are the things associated with the probability of leaving the job? Well, as Shireen noted in the earlier presentation, there are a variety of different factors, some of them to do with the individual themselves and some to do with the job. And it's helpful then to distinguish between different types of exits. So in our data, we can identify those who are moving to non-employment from those who are moving to another job. And what we find is that those exits to non-employment are usually about personal characteristics. So maybe you're coming up to retirement age, maybe you have a health problem, which means you can't work anymore. Maybe you're leaving to look after your children. Some of those personal life things that employers perhaps can't do an awful lot about. But there are also people who are leaving social care for non-employment, who are on very low hours. So maybe they have a weak attachment to the labour market, and particularly exits to non-employment are more common among those people who are on very low wages. So maybe the returns to working aren't good enough to keep them in the labour market. If we then focus on those people who leave a care work job to move to another job, then as you might expect, the characteristics of their job are more relevant for those kind of exits. So people who are moving to other jobs, those kind of quits are more likely amongst people on temporary contracts, those people who are working non-standard hours, and those people who are in jobs where there's no job-related training. So certain elements of job quality seem to be associated with a higher probability of moving to find another job. Exits to other jobs are also more common for people who are working in the private sector. So there's more job-to-job moves if you work in the private sector. And also if you work in an urban area, it's more likely you're going to move from your existing job to find another job. And that's because there are going to be more outside options in that area, more other social care work that you could possibly do. So if we look across the piece and look at the relevance of different job factors, the kind of things that employers might be able to affect, what we see is that those people on permanent contracts, those who are working standard hours and those who are getting training, those are less likely to be quitting for other jobs. And those things seem to be more important than pay. So those people on permanent contracts are 10 percentage points less likely to leave their job than those on temporary contracts. Those working standard hours, 6 percentage points less likely to leave their job than those on very low or very high hours. And those who are getting training, about 6 percentage points less likely to leave their job than those who are not getting any job-related training. If you compare that then with the importance of pay, if you move across the interquartile range, so if you're working in a job where your pay rate is at the 25th percentile, and you move up to the 75th percentile of the pay distribution of care work, moving from the bottom quarter to the top quarter of all the pay rates you see among care workers, then that move is only associated with a very small decrease of 2 percentage points in your likelihood of exit. So what we sort of see there is that, as Shireen was saying earlier, the non-material aspects of the job outside of the pay, things like the contract type, the hours you work, the training you get, seem to be more important than the pay rate. And that might be simply because that the distribution of pay in care work is actually not very great. It's probably quite hard to go and find a job which is really paying a lot more than the one you're already getting. So if we could go to the next slide. Thank you, Grace. So then what about this comparison with other occupations? Whilst care work is not unique, you can find a number of other caring and personal service occupations with a similar level of job separation. So if you look at nursery nurses, veterinary nurses, hairdressers, again, around about 25% of people in those jobs are leaving their jobs every year. But there are other caring roles where the separation rate or the exit rate is quite a bit lower. So if you look at nursing auxiliaries or healthcare assistants, as they're sometimes known, if you look at teaching assistants, the share of people in those jobs who leave every year is about 10 percentage points lower. So it's not around 25%, it's more like 10 or 15%. So people in those jobs are less likely to leave. And our analysis suggests that differences in the work setting seem to be important in explaining those differences. So what you see is that most care workers work in small and medium-sized workplaces in the private sector. And those kind of workplaces tend to see a lot of quits amongst different types of jobs. Most nursing auxiliaries work in large workplaces in the public sector, and those kind of jobs tend to have quite low levels of quits. Now, there might be a number of reasons why large public sector workplaces have low quit rates, but one might be the kind of opportunities that they offer for career progression. So if you look at the chart at the bottom right of this slide, what you'll see is trying to estimate the returns that you get in your wages if you stay in your job. The blue line is care workers. So care workers who've been in their job for between 5 and 9 years only earn about a couple of percentage points more than those who are new hires after you control for a lot of other factors. Whereas if you look at nursing auxiliaries, they're tending to earn about 10 percentage points more after about 5+ years. And if you go to 10+ years tenure, then the gap gets even wider. So it could well be that there's something about these kind of work settings, public sector, large workplaces, the kind of places you tend to find nursing auxiliaries, where there are more incentives to stay around because your wages are going to increase if you stick with your employer. And it could then be that in care work, you're needing to move around to actually get some wage increase. So if we could go to the next slide, Grace. So in this analysis of the annual population survey, what we see is that adult social care isn't a complete outlier. So the kind of solutions to improving retention are not likely to be entirely unique. Some of them are just about understanding the dynamics of low wage work. And some exits are hard to prevent. So family circumstances, maybe it's a stopgap before studying, maybe you have health problems, but there certainly is a sense in which job quality is important, making it worthwhile for people to remain in work rather than exiting to non-employment and reducing the pull of jobs elsewhere in the labour market. So things like provision of permanent contracts, standard hours, provision of job-related training, and to a lesser extent pay. Those are the kind of things that seem to come out of this analysis as being important. But the work setting is also key. So if when we make that comparison with nursing auxiliaries, it looks as though perhaps something about the absence of job ladders might, within a particular firm for social care workers, the inability to really increase your pay by sticking around with the same employer might also be a factor explaining why care workers then go out and look for jobs elsewhere. So the kind of questions then that promotes are, well, how would we then create incentives for employers to offer good quality jobs? And how could we create pathways for wage progression? So that's it from me. I'm going to hand over to the next presenter, which I think is Florian. and we'll take questions at the end. I see a couple in the chat, so I'll try and pick those up later on. Thank you.
Thank you, John. So the study on job separation and sick leave of social care frontline staff that I am presenting is joint work with Irini Saloniki. Despite the rather wide interest in improving staff retention, there is, until to this work, there was no really hard evidence on what factors drive the retention of care staff in England. And the main aim of this study was to address this research gap and find answer to questions like what factors under the control of care providers and or policymakers are related to social care staff turnover, how important is job quality, in particular wages and guaranteed working hours for staff retention. And as labor input is not only lost through permanent withdrawal from a job, but also through temporary withdrawal, for example, through sick leave, we also assessed factors related to sick leave and also the relationship between turnover and sick leave. Data used was from 4 cuts of the adult social care workforce data set, October 2016, 17, 18, and 19. We included in the analysis public, for-profit, and not-for-profit establishments, and focused the analysis on care homes with or without nursing and domiciliary care. Included were workers aged 16 to 64 employed in a direct care role, so care workers, senior care workers, or other care providing role. Next slide, please, Grace. An important problem in estimating the relationship between wages and job separations comes from the failure of adequately control for other relevant factors, causing estimated effects of wages to be biased towards zero. In this study, in order to correct for this potential bias, we had the opportunity to use a very large number of covariates on individual, job, employer, and local labor market characteristics, but also to make use of the longitudinal nature of our data set to control for time-invariant unobserved factors. And the main findings of the regression analysis show that taking into account unobserved factors leads to a significant improvement in the estimated wage effects on job separations. We found that a 10% wage increase from the sample mean would reduce the job separation rate by about 3 percentage points. Also, an increasing wage does not have a linear effect, with the effect being stronger on reducing job separations at lower wage levels. Our results also confirm previous findings that employment on part-time contracts and zero-hour contracts increase the likelihood of job separation. And we also found a small negative effect of CQC quality ratings of the establishment management on job separations, showing that leadership is not unimportant. With respect to sick leave, we found that the sector of employment was a very strong predictor, even after controlling for other factors. Direct care staff employed in the public sector having 60 to 70% more sick days per year compared to staff in the independent sector. And this difference could be explained by differences in contractual terms and conditions, with much better conditions in the public sector. Next slide, please. Thank you. Our findings show that social care staff retention may be improved by increasing wages, so when adequately controlling in the estimations. So the effect is not very large, but taking into account that the difference in pay between staff employed in the independent compared to the public-owned establishments is about 30%. A pay alignment between sectors could provide a significant reduction in job separations. Increasing wages should, however, be combined with other aspects of job quality, like full-time contracts, guaranteed working hours, for a more meaningful reduction in turnover rates. So to conclude, a potential coherent strategy could be to align paying conditions in the social care independent sector to those in the public sector. However, these changes will come at the cost of the public purse, as tariffs paid by local councils will need to increase in order for independent care providers to be able to afford to pay higher wages and offer more generous contractual terms and conditions. Thank you. I'll stop here and I give over to Hansel.
Hi, I'm Hansel, and I'm a research associate at PSSRU, and today I'll talk about joint work with Florin and Irini on recruitment, retention, and employment growth in the long-term care sector in England. Right. So we know that the increasing demand for long-term care services is going to put upward pressure on the care workforce, and implies basically a need to grow the care workforce. So this study basically builds on the fact that at any point in time, the size of the long-term care workforce is essentially determined by inflows and outflows, inflows being hiring and outflows being separations or turnover. And basically, to understand what sort of policies are best for growing this workforce, this long-term care workforce, we need to understand the relative importance of these two factors, the inflows and the outflows. And so the aim of this study is basically to understand the relationship between turnover, hiring, and employment growth of care workers at the establishment level. And the idea is that we want to assess the relative importance of hiring and turnover in explaining employment growth and decline. So basically explaining the expansion and contraction of the long-term care workforce at the establishment level. And to do this analysis, we use the adult social care workforce data set, which is basically the same as the one that Florin just talked about previously. So I'm going to skip the details on that. Could I have the next slide, please? So jumping straight to the main findings, what we found is that controlling for establishment level heterogeneity and many observable establishment level covariates, we find that turnover and employment growth are in general negatively related across the entire growth spectrum. So what does that mean in simple language and in pictures? So if I could refer you to the top right figure in the slide. So what the data shows is that amongst contracting establishments, basically establishments which are experiencing a shrinking care workforce, as those that are losing more workers per year, those that are losing more care workers per year are also on average decreasing in size, and that's basically very straightforward and logical. But the interesting finding here is that there is also a systematic relationship between employment growth and turnover, and that you can see on the right side of the figure. And what it says is that establishments which are successfully increasing their workforces are also those that have systematically lower turnover rates. So what does that mean in terms of policy, right? It basically says that staff retention policy is important not only for thinking about arresting the decline in an establishment's care workforce, but it's also important when we're thinking about expanding employment within an establishment. So that's something new that we haven't really thought about before. And so now turning to hiring rates, we conducted basically the same analysis to analyze the relationship between hiring rates and employment growth. And we found that across the entire growth spectrum, hiring rates and employment growth are positively related. So for cases where establishments are growing, this is perfectly logical and intuitive. establishments which are growing faster show systematically higher rates of hiring. But what's interesting here is that we found that amongst establishments which are contracting faster, so basically establishments which are whose workforces are shrinking faster, also systematically show lower rates of hiring. Now, if you think about it, amongst establishments which are contracting each hire is essentially a replacement hire. So what this finding shows is that establishments which are shrinking seem to be experiencing difficulties in finding replacement hires. And so to sort of understand what's behind this, we also did additional analysis looking at the change in unfilled vacancies, and we found that amongst this group of establishments, basically those whose employment of care workers is decreasing across years, we find that they are reporting at the same time increasing numbers of unfilled vacancies. So what exactly does that mean? It means that these establishments are experiencing recruitment frictions, right, which are preventing them from finding replacements for leavers, basically. And so if you look at both plots, they basically show separately the turnover rates and hiring rates for across sectors. And we also found, in addition to these broad relationships, that turnover rates and hiring rates are systematically higher in the private sector relative to voluntary and local authority establishments. And not shown in this picture, but we also find the same systematic difference between domiciliary care, which is higher than residential care. So this in turn implies that there seem to be higher levels of churn in the private sector relative to the public sector, and similarly higher levels of churn in domiciliary care relative to residential care. So can I have the next slide, please? So again, what are the policy implications of these findings, these relationships, basically? So as I mentioned, the fact that we find that lower levels of turnover is systematically related to growth implies that turnover and retention policies are important, not only when you're thinking about the case where not only when you're thinking about arresting the decline in employment in some establishments, but it's also important when you're trying to think about expanding your workforce in a sustainable way. And our findings with respect to hiring shows that recruitment frictions are important for explaining why employment in some establishments are declining. And so in turn, differences in recruitment strategies may across sectors may explain differences in the levels of churn, which I briefly mentioned. And so this work basically leads us to a question which we don't quite have an answer to right now, and the question is basically which recruitment strategy is more suitable. What I mean by that is that on one hand, if establishments wish to expand their workforce, one way they could go about doing that is to be more selective in order to find better matches. And the cost of that is that they may have a lower hiring rate. It will take more time and possibly be more costly to recruit the same number of workers. But one benefit of that in the longer term is that it may in turn lead to lower levels of subsequent turnover because each hire is a better match. But on the other hand, if another approach might be to cast a wide net, in the sense that establishments may choose to just increase hiring rates at the cost of possibly higher turnover subsequently. And so what our work shows is that may not necessarily be the best way to go about it. And so really, I think this is an interesting question that this work brings up, and which is still up for discussion. So with that, I conclude. Thank you. And
Thanks, Hansel. Hi, everyone. I'm Steve Allen from PSSI, Senior Research Fellow at PSSIU at the University of Kent. And I'm going to talk to you about our study in RESSCW on recruitment and retention of personal assistants. So I was a member of the research team along with my fellow members. In terms of a motivation for this analysis, increasingly policy is aimed at personalisation of social care services, and so currently there are over 100,000 personal assistants working in up to around 135,000 plus jobs in England who are directly employed by people to support their own care needs. But there's little research on PA recruitment and retention, particularly for England, but across the world as well. And so the aim was to assess the economic factors associated with personal assistant job vacancies and turnover as a first stage, and as a second stage, looking at the factors associated with personal assistant sick leave, as Florin previously intimated and showed in his slides. The link between sick leave and turnover of staff is seen within social care. So the data and methods that we used, well, we used the Skills for Care survey of individual employers and personal assistants, which is 2 waves of survey data from 2017 and 2019 of those who employ personal assistants and the personal assistants they employed. And so for the first stage, looking at job vacancies and staff turnover, we used the Skills for Care survey of individual employers. And for the second stage, looking at personal assistant sick leave, we looked at the survey data of personal assistants, which meant we could look at more individual level personal assistant data. For the second part of the study on personal assistant sick leave, we also had 2 people with lived experience join us on the study, Eleni and Deb. Next slide, please, Grace. In terms of the findings, I'll just give you a whistle-stop tour of these findings. So they're very similar for the PA, for the personal assistant job vacancies and turnover, and for personal assistant sick leave. So for personal assistant job vacancies and turnover, local unemployment levels at the local authority level reduced job vacancies and turnover, the likelihood of having a job vacancy and staff turnover for an individual employer. So there's a counter-cyclical nature of social care employment. As would be expected, the number of personal assistants that are employed increased the likelihood of having a job vacancy and or some turnover. Potentially counterintuitively, employer training increased the likelihood of job vacancies and turnover, and we're probably seeing there a circularity in the relationship that those employers who are having the most difficulties with job vacancies and turnover may be those who are most likely to get the training to help them to improve their recruitment and retention of personal assistants. We also found that alternative social care employers within the local area, so number of care homes and number of home care providers registered with the Care Quality Commission, increased the probability of job vacancies and turnover, and also sick leave. For sick leave, we also found that distance travelled to work by the personal assistant increased the likelihood of sick leave. We also found little evidence that personal characteristics such as gender and ethnicity had any influence on the likelihood of sick leave, nor age. The limitations to this analysis are that the survey data was not extensive. I mean, it covered quite a lot of information on working conditions, but didn't have anything about the relationship between the personal assistant and the individual employer, for example, which will be a crucial aspect in the working relationship. And also the survey data may not be representative. It was a small sample of personal assistants and individual employers, but we note that the results are consistent with previous qualitative research in this area. The policy implications for this work, well, we've shown that personal assistant markets are extremely local, so local authorities need to consider these markets distinctly within their areas. So larger local authorities, if you have a town with high levels of employment, they need to consider how to assess that local market for PAs separately from a market elsewhere where there's lower levels of employment. We also show the interlinked nature of social care employment. So again, what John and Florin have been talking about, the movements from one part of social care to another. And so policy needs to consider how to appropriately use that interlinked nature of social care employment to improve the recruitment and retention of personal assistants. And then in terms of the outcomes of recruitment and retention issues, are there any, we don't know if there are any costs or what the costs are to the outcomes of individuals who employ personal assistants, and what the costs would be to the health and social care sector as a whole. If there are costs to the health and social care sector, then these could possibly be offset by improving funding to social care to improve pay and conditions for social care staff. Okay, thank you very much. I'll pass you on to the discussion of COVID-19 implications.
Hi, everybody. It's me again. So we're going to give you some findings from our additional work package, because as Florence said, the whole project started in April 2019, and then when we had COVID in 2020, the Health Foundation was generous enough to extend our funding to have a strand of work specifically focusing on the impact of COVID-19 on the experience of care workers. So that is primary data collected from care workers. So the aims of this work package is really to look at the implications of COVID on care workers, general well-being, working conditions, and intention to quit the sector. Also to identify if there were certain workers with specific individuals or work characteristics more likely to be negatively impacted, adversely impacted by COVID-19. And also whether any of these implications differ by care settings, especially between domiciliary and residential care. So if we go to the next slide. And if we move the slide, Grace, so we can have everything. So just the timeline, we've received extra funding in March 20. And straight away, we developed a pulse survey or an online survey, which we have piloted with a small number of care workers. And that was launched in July, August 2020, and we had just under 30 participants. We analyzed and then we used this as a discussion point, a springboard with qualitative interviews from some social care stakeholders. So we have a top-down approach in addition to the bottom-up approach. And that helped us then to do our main or core work, which is a longitudinal survey of care workers. So we started designing a two-wave survey. We engaged with people, we discussed with people, we piloted, and we recruited participants. And in April to June 2020, we completed our first wave and achieved over 1,000 participants. We analyzed the data and then again engaged for the second wave. And we finished the second wave in January 22, and we had a longitudinal panel. So we had some of those who have responded in wave 1, responded to wave 2, which was substituted by a cross-sectional panel of new respondents. And since then until now, we've been doing some analysis cross waves or kind of cross-sectional at each point and disseminating. And we're going to talk a little bit today about some of the analysis coming from wave 2, but primarily as a panel, as a pooled data. Next, please. So in terms of the survey content, just to say that Irene, this is work that is done with Irene and myself and other people, other colleagues, and I'm going to invite Irene to jump in the next slide. I'm not expecting you to read all this, but just to highlight that there has been a lot of discussion between ourselves in the reference point for the survey. So in the wave 1, we referenced the start of the pandemic because that was recent, and in wave 2 we referenced like 6 months ago. So we have there has been different points, of course, in the timeline of COVID and different waves and different restrictions. So I'm going to invite Irene now to talk about some of the results.
Thank you, Shireen. So I'm Irene Saloniki. I'm a senior research fellow in health economics at UCL. If we can move on to the next slide, please. So we had in the longitudinal survey, we had a big number of work-related factors. So we had to find a way to group those factors to use in the analysis later on. So I'm not going to bother you with the details, but we did factor analysis and we identified 4 main categories for those factors. So job satisfaction, that could include things around overall satisfaction with your job, satisfaction with pay, job security, and so on. Organizational commitment is another group, and that relates to things like seeking use from employees or allowing employees to influence decisions. Then we had another group which relates to feelings at work or feeling good at work, and that could be things like how often your job makes you feel enthusiastic, optimistic, relaxed, and so on. And our final group was about job supports. And that can be things like whether you are treated fairly in your job, whether you are being respected, and so on. Next slide, please. So we thought we'd give you a taster of the main findings from both the surveys and also the qualitative interviews. Some of the findings are available either in a report format or in some kind of presentation slides or working paper. So for the poll survey, we did find that workload and impact on general health was quite significant. There were issues at the time, so that reflects the first wave of the pandemic, and there were issues with COVID-19 related training as well as access to PPE. There was some differential experience among BAME respondents, but we need to note the small number of cases for this group in the poll survey. In terms of the qualitative interviews with stakeholders, again, issues with anxiety were highly noted, but and the fact that the social care sector felt to be abandoned in the early months of the pandemic. But also another interesting topic was about growing concerns in relation to abuse of the workers during that time. And taking from that, and also from references to social media in relation to abuse, we thought we focused the analysis of the first wave on abuse. So what we find is that a quarter of our respondents did experience abuse in relation to the pandemic, and workers from coming from a BAME background were mostly affected. We did identify that abuse incidents were more common in residential care than domiciliary care. And we also, consistent to other literature in this area, we found a negative relationship between abuse and work-life balance, as well as intention to quit. So one thing to point out here is that in this work package, we are talking about intention to quit rather than actual quit, which is what my colleagues discussed for the other work packages. So that might make a small difference. And in the final analysis, we call it pooled analysis. You can also call it panel analysis. It doesn't really matter, is where we bring the two waves together, and we are trying to see whether there are any differences across waves or overall. And what we find is that, interestingly, in wave 2, which coincides with the peak of the Omicron variant around Christmas time, we do find lower job satisfaction, job supports, and worse feelings at work compared to the first wave, which was around the summer last year. We also find that overall males were more likely to quit than females, and that might be because that males are more flexible, have more flexibility to move between jobs, whereas females have more caring responsibilities. We didn't find any significant difference in quits when we look at care settings. However, in terms of the minority groups, BAME respondents, we identified that we're significantly more likely to quit their current employer, but this effect is weaker when we are looking at quitting the sector altogether. One thing to point out, because I saw it coming up in the chat quickly, there was a question about contracts and whether we find any effect in the COVID-19 analysis. We actually find the opposite relationship, so that those workers on permanent contracts are more likely to quit, which contradicts the finding from WP2, from the second work package, but is something we have to reflect on and might really be linked with the timing of this work. And we have one final slide. I'll hand over to Serene for some final points.
Yeah. Thank you, Irene. First, we need to apologize that we're running over, but I think the implications are really wide. And if we put all the work packages, the findings coming up, and also at the time of policy change and policy reforms and the white paper and the fair cost of care, I think what's coming up very strongly that care workers felt neglected and undervalued. Workload, job satisfaction, the sense of responsibility, well-being come up over and over across different work packages, and that can have different dimension, whether it's physical, mental, or financial. That leads to further retention issues. And really situating this with other kind of forces that are happening, particularly Brexit and the different pools of workers that might be available or not available, as well as the expansion in care services and the changes. And for example, we're seeing a growing interest in live-in care, and that has different dimensions to think about. Really what we call for is a better wide changes, better pay and better jobs, and funding, and taking the funding discussion around the increase in the levy of the national insurance and reforms that are happening as a springboard to kind of use the findings from the whole project to inform the coming policies, or try to influence that, and think about broadening the pools of recruits, how we can create different mechanisms to recruit different ones. And different groups that are not usually traditionally attracted. There has been some geographical disparities, and then there is a big issue of the impact on users and their informal carers that this project hasn't been able, it's not one of the aims to look at it, but there are definitely some intersection here. And overall, it's really the well-being question. So we'll stop here. Thank you very much for listening. And I think if you can hang up with us for another 10 minutes to take your questions, or write to us with any further questions, that would be fantastic.
Thanks, Shireen. Thanks, everyone. Yes, you'll have seen people in the chat that we've been leaving some details for some of our two PIs, which is our principal investigators, Shireen and Florin. And I've also included John's email with his permission in the chat. I suggest our other speakers also place their emails in the chat. They're happy to be contacted for follow-up questions, please, because we have run over and we have another meeting that we need to go to in a minute. I've been keeping a look at the questions, and I know some of you will already be talking to us as part of our study steering committee later today. So I hope you'll forgive me if I don't prioritise your questions, because you'll get a chance to talk to us as part of that meeting. I don't know your first name, but M. Mitchell, so apologies, I can only see those details, raised a really interesting question, said, can you say anything about how you identified care workers within the APS, please, John? We find discrepancies between 6 SOC-based approaches and the Skills for Care database. Now, John, would you like to answer that one quickly?
Yeah, very briefly. So yeah, the annual population survey does give different numbers to the Skills for Care, but we use the standard SOC codes for care workers, so 6145, 6146, and then look at those people who are in care work in the industry sectors that relate to adult social care in the standard industry classification. So it's very similar to what the MAC do in their report. And there was a follow-up question, I think, about the pay ranges. So what I was talking about there is if you move along the pay distribution for care workers themselves from those at the bottom quartile to those at the top quartile, then the separation rates across that distribution don't vary very much. So I'm not looking there at how the care workers' pay necessarily relates to what's going on elsewhere in the labour market, but that's something we're working on right now to try and better identify the outside options. But what you do see is that care workers are more likely to leave in urban labour markets where there are more other jobs around and more other opportunities. So that's something we're working on. So please do drop me an email and I'll keep you in touch with that work. Thank you.
Okay, thanks, John. Just a follow-up question as well from Ian Edwards saying, does standard hours mean set hours or does it include shift working?
Yeah, so shift working is not well identified in the annual population survey. It's missing for most people. So what I'm talking about here is the usual number of hours you work in a week. So those people who work relatively low hours on average in a week, so less than 24, are more likely to leave than those who work standard hours, and equally those who work a lot of hours, so more than 48 hours a week on average. Those who are in those long hours situations, they're also more likely to leave. So it looks as though a provision of a sort of standard set of hours of working, what would you normally think of as usual, between about 24 and 48, 6 to 8 hours a day, 6 to 9 hours a day, seems to be associated with a lower likelihood of leaving the job.
Thanks, John. And just a quick point to pick up from Jack Savage on Steve's presentation on personal assistants, just to say that future or extended research should involve exploring the relationship between personal assistants and individual employers in terms of recruitment and retention, as we are a group that could have really contributed to a wider picture. Steve, would you like to comment on that or respond to that?
I certainly agree on the overall idea of that looking into the relationships between personal assistants and their employers is extremely important, and there is some research out there already that is looking at that. In terms of our analysis, I think haven't been able to do that because there is a lack of data. So certainly we should be able to do that, look to do that in future research. But in our analysis and our study, we've been able to use people with lived experience, have worked as study team members, and so they have contributed to this work not from the inception of the research question, but from before the research analysis. So they are able to input into the research analysis as well as provide help with and support in working on the dissemination strategy.
Great, thanks, Steve. And that actually partially answers Lenny Chambers, who's asked, great to see myself and Deb acknowledged by Steve just now as public members. What sort of patient and public involvement was there in other parts of RESSCW? So I think you've partially answered that anyway. And I think there's also some details on our project webpage about this, isn't there?
I think Anne-Marie should take that, because you've done a lot of work in this side. So if you can give a brief statement.
Yeah, so we've had public members involved in every aspect of the project, and in particular around consulting on the findings of the results. So I think one of the things that we thought was going to be very important in this particular study, because it is quite a technical study, there was an awful lot of analysis going on, that it was really important to sense check those findings with people working in the sector. And part of that has been all the events that we've run, but also we've had public involvement and people with worked and lived experience throughout the study. So hopefully we've been able to do that. And we've done that also with the support of some other organisations such as the National Care Forum, who have been really valuable in connecting us to people working in the sector.
Yes, and not to forget, we had also very valuable PPI input on the surveys. So when we set up the surveys for the assessing the COVID pandemic on care workers.
That's right. Okay, there are some more questions, but I'm very conscious of time. I think speakers have been kindly putting their details into the chat, so I would really encourage you to contact the speakers directly if you have any follow-up questions, although we've not been able to get to today. And apologies to our steering committee members who have questions, but you will get a chance to raise those in the next meeting, which I hope is okay with you, that I made that decision today to prioritise. I think it's over to Florin and Shireen just to say thank you and goodbye.
Yes, Florin, do you want to start?
Yeah, thank you very much, everybody. So yes, it's great to have such a large audience, and I really hope you come with questions to us. We are more than happy to answer anything you raise.
Yes, and clearly we are very grateful for everybody who stayed and everybody who has come today. It's a great study. There is a lot coming out and there is a lot of details. Do check the website, do get in touch. We will be more than happy to respond to any questions, but also think about future, kind of how we take that forward with different organizations, because it brings up more questions. And I guess as we kind of pointed out, this is timely when we think about the reforms that are currently happening, the House of Commons kind of evaluation of the government commitment to the health and social care staff workforce. So there is a lot of opportunity to inform the policy debate and to bring some of the findings. And the last thing is really, we're very grateful to the health foundations for the funding, but also being responsive when we ask it for more funding to do the COVID-19 work, which I think provide, fills in huge gaps and brings in the voices of care workers to the forefront. Thank you, everybody.